repair damaged cells. Picture a tiny mechanic fixing a broken machine from the inside. That's what these nanobots could potentially do. They can be programmed to identify and repair damaged cells, possibly even before we know something's wrong. In essence, nanobots could become the ultimate precision tool in medicine, able to target and treat illness at a level of detail and accuracy we've never seen before. This could revolutionize the way we diagnose and treat diseases, making the future of medicine not just more effective, but also more personalized. The potential of nanobots is staggering, but it's not without its challenges. Imagine the possibilities when we can program these tiny robots to deliver personalized medicine directly to the source of ailment. They could perform precise surgical procedures at a microscopic level, reducing the risk of complications and speeding recovery. And think about improved drug delivery. Rather than flooding the entire body with medication, nanobots could deliver drugs precisely where they're needed most, minimizing side effects and maximizing effectiveness. Yet, as with any groundbreaking technology, there are hurdles to overcome. Safety is paramount. How do we ensure these microscopic machines don't cause harm to healthy cells or tissues? The body is a complex system, and even the smallest interference can have far-reaching effects. Regulatory challenges also loom large. How do we create a framework to govern the use of such an innovative technology, balancing the need for progress with the imperative for patient safety? And then there's the ethical dimension. The potential for misuse of nanobot technology is real. In the wrong hands, could they be used to harm rather than heal? These are questions we must grapple with, even as we marvel at the potential of nanobots. While the journey to fully realize nanobot technology is still underway, the promise it holds could change the face of medicine as we